Hello, and thank you for joining me. My name is Phil Jacobus. I'm here in Woodstock, New York, and today is the 21st of July. Today, I have the pleasure of being joined by Mr. Matthew Michela, who is the president and CEO of Life Image. Before I'm joined with Mr. Michela, I'd like to take a look at a couple of our news stories. Let me share my page with you. Here you see that there is a strike at a hospital in California. About 200, nearly 800 Santa Rosa hospital employees went on strike because of shortages and benefits and PPE deficiencies. Providence St. Joseph Hospital, of course, is the owner of that facility. Here you see that imaging volume for US healthcare systems are down by 55%, some say. We're hearing that in a lot of the hospitals that we speak with. If we jump here, Dr. Joseph, and forgive me, Dr. Joseph Magerfelt, I'm sure I'm mispronouncing that. He was appointed the director of preventative cardiology at Mount Sinai Kravis Children's Hospital. You know, we have people in the news and people on the move almost every day. If we jump down to the press room, we see that not only is our imaging volumes down, but here's a study that shows that patients are waiting longer, some as long as 6 months. And this is an interesting story where Change Healthcare has its smart pay technology is integrated with Epic's MyChart. So these are just some of the stories that you would see if you visited our news or signed up for our daily digest every day at healthcarebusinessnews.med.com/news. I encourage you to do so. Today, we're being joined, as I mentioned, by Mr. Matthew Michela, who is the president and CEO of Life Image. Not to repeat myself, but forgive me. Thank you for joining us, Mr. Michela.
Oh, thank you, Phil. Appreciate the time to talk with you today.
You know, for anyone watching who isn't familiar with Life Image, can you give us a brief overview of your company?
Sure. Life Image is a healthcare technology company. Basically, we provide software solutions that support the largest evidence-based network connecting providers to each other, to hospitals, to facilities, to imaging centers, to patients, and to a wide variety of healthcare organizations that need access to medical information, medical evidence in order to do their work within the healthcare system. And so we are a 13-year-old company just about now, have about 10,000 facilities connected in the US, another 70,000 overseas. Almost 200,000 providers use our platform on a daily, weekly, monthly basis, and we help support clinical diagnosis, treatment, post-acute care by providing access to essential medical background history and information for somewhere north of 12 million or so patients in the United States every month.
That's quite a record. You know, you've written for us about in Healthcare Business News magazine. We've written about interoperability. Can you speak to us about how interoperability benefits both the healthcare provider and the patient?
Sure. So out of kind of the context for interoperability, and it's a phrase that we've been bouncing around the healthcare system for more than the 3 decades I've been involved here. And so it historically has meant whatever is in the eye of the beholder, but generally, right, refers to creating technology solutions that break apart the data silos that have unfortunately been constructed in healthcare to hold healthcare information and make it, and by nature of how it's been constructed and how it's used, that data then is very, very difficult to access for when you need it to diagnose a patient, to treat a patient, to conduct clinical research. And these barriers that have been set up, which are technological by practice and by and by regulation in some regards, right, make the entire system more costly. Interoperability is breaking those data silos down so the data can accelerate from wherever it's born or wherever it lives into the hands of the person that needs it with the right information at the right time so they can act. So if you think about a physician and treating a patient, the physician can only apply their art to making a diagnosis or determining treatment based upon the information that they have available in front of them at that moment in time and apply their very best judgment. If the information they have is incorrect, it's out of date, then the treatment or the diagnosis may be incorrect, the patient can be harmed. This is many examples of this, right? If a patient has a drug allergy or a contraindication to a medicine and you don't know that, but it sits over in a data silo somewhere else across the city. It sits in a pharmacy somewhere. Historically, it was written on a piece of information, and the physician doesn't know that. Then she or he may write a prescription that then causes the patient harm. And this happens millions of times a day, considering the complexity of medicine, the types of data that are available. We are far from having perfect information on the patient. We're so far from that in many cases, the tens of thousands, 50,000, 60,000 patient deaths that we have every single year, and many of them are completely unnecessary medical errors that can be ultimately touched on and influenced by the lack of interoperability in the data system to get information to the provider in order to treat the patient. Lack of interoperability for patients specifically, not only does it put them at risk by having an inferior diagnosis or treatment that they're participating in, but it also tremendously inconvenient, costly, and generates tremendous dissatisfaction when they can't have access to their data, or it may take them 30 days to get it, or they have to run around for it, or they have to fill out a dozen different forms, and the system itself is not constructed in a way to provide access to patients, ready access to patients when they need it, for whatever their purposes are, right? It is their data. It should be their data. They should be able to use it for any purpose that they choose to do that for. But in our system today, it's incredibly challenging because of the lack of interoperability for them to be able to participate.
How does your, I take it you have a software program. How does this catch these mistakes?
Sure. So we focus on, when you think about software and hardware databases where data is stored, historically, right, organizations, manufacturers build these solutions, whether it's a database to hold your MRIs or it's an EHR that may hold your clinical reports and your blood pressure, et cetera. They're built to accomplish the clinical purpose. They've not been built in order to provide access to that information from for other purposes and to other organizations. So what LifeImage has historically done is we work with those manufacturers. We work with hundreds of them, right? Even just in the imaging space, we're talking about more than 500 manufacturers around the globe, working with all of the major EHRs and hundreds of other software vendors. And we work with them and integrate, right, our software into theirs that allows data to flow between the two systems digitally, quickly, and without being altered. And so that's that's a decade, right, and a half almost of, kind of dirty programming at the integration level, relentlessly to provide and free up data from those data silos to flow across the network.
Forgive me, but how big is your IT team?
So it varies, right? Because we have an internal and an external team. So, today we're relatively efficient. So our entire employee base is less than 100 FTEs today. Here, we've been larger at times and we've been smaller at times over the years.
So it's a very, very scalable business model. What about legislation? What role does legislation play in interoperability?
So legislation is incredibly important, right? And if you look back at the Cures Act that was passed, right, by the federal government, and then the regulations that have been put in place by the ONC more recently, determining that data standards consistent across vendors will be followed. So it really tries to drive a stake in the heart of software and hardware manufacturers that create proprietary systems and technology and software that prevent data from flowing freely. If everybody uses the same standards, it accelerates the ability to integrate and access that information. And then they've also created a set of rules and penalties that should organizations not comply, then there are consequences for that as a means of moving the industry from a technology point of view forward in a more standard way. They've gone even, I think one of the best things that the ONC really has done here is, and they've done a great job in creating their new set of regulations and rules, is creating that initial data set and the structure that identifies what data is essential, right, for clinical decision-making and for payment. And they've mandated that that data become available not just to clinicians or not just to an insurance company for payment, but directly to patients. And that's a major step forward, right, in making sure that healthcare as an overall system, when it comes to moving information, comes into this current century here in ways that decades ago the financial services moved, or even, frankly, grocery stores and supermarkets that track the food you buy and let you apply coupons has been a generation ahead of healthcare for a long period of time. And so this this new government rules, the regulations, the government, the enforcement actions here really have set the foundation in place for healthcare to finally, right, stabilize its foundation and provide the opportunity for data to flow under the right consents with the right, security provisions here across to whomever ultimately needs it to improve healthcare. That's going to help the overall system itself. So while I think we'll have untold, right, better patient care issues and fewer over time, right, medical errors and deaths and consequences from that, we'll have more effective payment with less errors around payment and the ability to understand that. We'll have better clinical decision making. We'll have better research here, which then has promise for all sorts of clinical improvements faster than they've ever been before, really, over time. And those things can have the promise of bringing down, right, the cost of healthcare in a fairly dramatic way when you can get the right information about a patient to the right clinician at the right time. It saves massive amounts of time and money along the way too.
And people's lives. Well, that's a very interesting product mix, very interesting idea, and my hat's off to you and your staff. I appreciate you joining us today, Mr. Michela, and I hope that we'll hear back from you in the future.
Thank you, Phil. I appreciate it. You have a good afternoon.